Then, as per my information, from your pharmacology second, I taken the 2 units. Okay. Yesterday, I get the information from the sir that student will told that I taken the only 1 unit, but actually I taken the this whole unit 2 coagulants, drug in the shock, anticoagulants, diuretics. That section already I taken. The notes is also uploaded on your Google Classroom. This 2 units. Then when I started the unit number 3, amongst that I already completed the introduction to atocoids and the histamine and antihistaminic drug. That part from the 3rd unit is also completed by myself. Okay. Then now from the 5HT section, that is a serotonin, I hand over this subject toward the Kale sir. Okay, so I taken the 3 bit total, and from the unit number 3, I started the histamine. Okay, so I taken the total 2 units. Then from today, it is means the unit number 4 is much more difficult, and it requires the more than 10-20 lectures. So it is not possible to cover your syllabus within this time duration. So sir told me to complete this section, that is unit number 5. Okay, then today I'm also, my notes are given to the Kale sir, so it is not possible to cover this section as well. I'm having this section notes on my email: estrogen, progesterone, and oral contraceptive. So we will start with this bit. Then when the time permits, and then we will start with unit number 4, or maybe Kale sir will continue the unit number 4. So from today we will start with the estrogen, progesterone, that is the unit number 5. This chapter will cover the more than 80%. जो युनिट नंबर 5 आहे त्यातला इस्ट्रोजन, प्रोजेस्ट्रिन अँड ओरल कॉन्ट्रासेप्टिव्ह हा जो सेक्शन आहे, दॅट विल कव्हर द 80%. 80% बऱ्यापैकी सगळा सिलेबस तुमचा 5व्या युनिट मधला, that will cover by this. Then already we are in practical, we get the knowledge about the bioassay, what is mean by bioassay. Then if the time we permit, then we will start with the principle and applications of the bioassay. So we will cover the unit number 5. Okay, before your sessional जे ISC सेकंड आहे त्याच्या आधी आपण दिस इस्ट्रोजन अँड दिस बायोअॅसे मे कव्हर, शुअर नाही सांगू शकत, बट जर आपलं झालं पॉसिबल तर वी विल कव्हर दिस. देन आय विल शेअर द नोट्स. And as you know that we don't have the time, so we will start the fast. एकदम फास्ट स्टार्ट करावा लागेल आपल्याला, बिकॉज वी डोंट हॅव द टाइम. इफ बाय आवर प्रिव्हियस पॅटर्न, if we will continue, then we will able to continue within a period, but actually your time is much lost, so it was not possible to cover your syllabus very slowly and within that time. If you don't understood anything, you may ask. Okay, आपण फास्ट चालू करावं लागणार आहे का तर आपल्याकडे तेवढा टाइम नाहीये. This chapter is covering approximately 50 to 60 pages. See here, 50 ते 60 पेजेसचा हा एकच चॅप्टर आहे. सो आपण खूप फास्ट कव्हर करूयात. झालं पॉसिबल, तुम्हाला काही क्वेरीज असतील तर तुम्ही मधून विचारा. Don't have any problem. So we will start with this bit, that is the estrogen, progesterone and oral contraceptive. Already you are known that are the contraceptive and the hormones. All the contraceptive action is done by the hormonal section. So estrogen and progesterone are the major hormone which plays the role in the fertilization process. So majority from this chapter, majorly the question is, write a note on anti-fertility agents. What are the estrogen? Describe the pharmacology of the estrogen. Then what is the mechanism, method of administration and adverse effect of the estrogen progesterone pill. Then what is the anti-fertility agents, and write a note on anti-fertility agent. म्हणजे बऱ्यापैकी questions like this. Then these are the various MCQ. I will share the notes on the Google Classroom regarding this. Then with the unit, what is the basic? That is the neurohormonal control of the female reproductive system. The puberty stage, when it is a young period, at that time the hormones are get synthesized and the released inside the body. when the time will gone, at that time in our body they're starting the secretion of the estrogen and the sex steroids. Okay, and due to that we are getting the specific feature to the male and the female. Means if we saw the child, or if we saw the any children or any baby below the age 10, that time it was quite difficult to differentiate that whether it is a female or whether it is a male. Okay, but once it will crosses the age limits, then it will came to know that it will be easily we can differentiate this is a male and she is a female. Okay, why it is so? Because at the age we are starting to develop the various specific characteristic in our body, and that will recognizable shape to our body, that will give the recognizable shape to our body. Okay, that time we come to know that this body feature is made up for the female and this body feature is made up for the male. Why that differentiation will came previously? Why it is not possible to easily differentiate the body features? Because once we are starting to the age of the puberty, at that time we get the a specific release of the steroid from the pituitary from the hypothalamus and the anterior pituitary gland, and that hormone will give us the specific structure, and that hormone will play the majority role inside our body for the reproductive system. It will be different. Okay, बाकीचं सगळं डायजेस्टिव्ह सिस्टीम, हार्ट सिस्टीम, युरिनरी सिस्टीम, जे काही आपल्या बॉडीच्या अदर सिस्टीम्स आहेत, लिव्हर, लंग्स, रेस्पिरेटरी सिस्टीम, ह्या सगळ्या सिस्टीम मेल आणि फिमेल मध्ये सेम आहे. ओके, अगदी मायन्यूट डिफरन्स असेल पण बऱ्यापैकी हॉर्मोन्स काय सेम आहेत, डायजेस्टिव्ह हॉर्मोन्स सेम आहेत मेलचे फिमेलचे, other all systems are same, but while we are focusing on the reproductive system, that time we came to know that the female is having the different hormone, totally different hormone inside the body, and the males are having the total different hormone inside the body. Clear? So that the reproductive system is totally divided into the two sections, depends upon the male or the female. Clear? So and that is majorly play the role by the hormonal system. Then we will sex steroid, we will focus on the sex steroid, that is the androgen section. Our body will having the cycle, म्हणजे आपल्या बॉडी मध्ये काय असते, एक स्पेसिफिक सायकल असते, आणि त्या स्पेसिफिक सायकल नुसारच काय होत असतं, आपल्या बॉडीमध्ये हॉर्मोन्स रिलीज होत असतात. फॉर एक्झाम्पल, when the hypothalamus gets stimulated inside the body, that it will send the message to the gonadotropin releasing hormone. Hypothalamus will send the message to the gonadotropin releasing hormone, and that will stimulate the pituitary gland. म्हणजे सगळ्यात पहिल्यांदा कोण स्टिम्युलेट होतं, हायपोथॅलामस. देन इट विल सिक्रीट द गोनाडोट्रोपिन रिलीजिंग हॉर्मोन. मग हायपोथॅलामस गोनाडोट्रोपिन रिलीजिंग हॉर्मोनला सिक्रीट केल्यानंतर तो हॉर्मोन पिट्युटरी ग्लँडला स्टिम्युलेट करतो. दॅट टाइम द पिट्युटरी ग्लँड विल रिलीजेस द FSH अँड द LH. कुणामध्ये तर फिमेल मध्ये. क्लियर? FSH and LH. What is the FSH? FSH, it is a follicle stimulating hormone, and LH, it is a luteinizing hormone. Clear? Already HAP मध्ये आपण शिकलोय की what is the role of the FSH and what is the role of the LH. Okay, FSH will stimulate the ovary in the and it will secrete the estrogen, while the LH will stimulate the corpus luteum in the male. Okay, LH काय करताय तर कॉर्पस ल्युटियमला स्टिम्युलेट करताय, and that will secrete the progesterone. Progesterone is also secreted in the female, but in a minute range. Clear? And that will provide the specific structure to the female. Means many times we will observe that some of the female are having the male characteristic in their body, means their dashingness, their confidence, their ability to survive in the world, and some females are having the shy nature. Okay, why? Because it all the role is played inside the body by the hormone. Means the female is having the more dominant progesterone inside body, that time that female is having the more malish characteristic inside the body, but that will not affect the reproductive system. लक्षात येते, म्हणजे फार प्रोजेस्ट्रॉनचा प्रीडॉमिनन्स असेल तर that time the reproductive system get hampered, it is not there. Because once there is a menstruation period it came, at that time there is an equal balance between the estrogen and progesterone during the menstruation period, and once that balance is came, that time only the menstruation cycle is happen. Clear everyone? Then the pituitary hypothalamus will stimulate the anterior pituitary gland that will release the FSH and the LH. Okay, that already we are studied in the diagrammatic path. Then the specifically when we are characterizing the menstruation cycle, normally it will be considered for the 28 days in case of female. Then the menstrual cycle is begins with the first 3 to 6 days menstruation, during which the superficial layer of the uterus, that is the endometrium, is get shielded. And after the menstrual, the flow stops. After the menstruation flow stops means completely endometrium is get released outside the body. That endometrium is regenerated during the follicular phase. Clear? Means that is, and that time for the development of that follicular phase, there the estrogen is playing the major role. And the estrogen is secreted inside the body from the day 5th to 6th. Okay, means first 5 days bleeding, and from the 6 days to it will start to generate the estrogen. Okay, that estrogen will provide the thickness to the endometrium of the uterus, and estrogen will play the role from the 5th day to the 13th day. Clear? And from 13th day, the level of the estrogen is get decreased, and that time the level of the progesterone is starting to increase inside the body. The proteinous food is responsible to maintain the pH of the uterine system, and specifically carbohydrate and the protein will play the major role. When the sperm is enter inside, that is a spermatozoa, it will enter inside the uterus, it will react with the ovary, and in that phase the gonadotropin release get decreased after the 13 days. Then it will be stimulate the release of LH, that is a luteinizing hormone, and that time it will secrete the progesterone. And from the day 14 to day 28, the progesterone is playing its role, and progesterone will stimulate the secretory phase of the cycle, and it will be implementation for the fertilization of the ovum. Progesterone is playing the role for the fertilization of the ovum. Means if the sperm is entered, if it is not, means in a normal woman, that time if the sperm is not there, that time again the estrogen and progesterone it came into the equal phase at the day after the 28th, and that time again the menstruation gets started. All of you clear the cycle? Means during that cycle the progesterone and estrogen playing the role. At the first 5th day there are no any hormone is there, it will be neutralized. In case of day after the 6th to the day 13, there is a release of the estrogen, and estrogen will play the all the roles which is necessary. After day 14th, the day 14 to day 28, there is a role of the progesterone is there, and progesterone is carrying all the cycle to forward. Once at the day of the 28th, if there is a no any ovum is generated, at that time the progesterone and estrogen is make the balance in between them, and that time again the menstruation is get started. All of you clear the cycle, and why that cycle is came due to the role of the hormones. Then it is a common cycle. Then we will study the focused part, that is the estrogen. What is the estrogen? The naturally synthesized by the ovary and the placenta. Body मध्ये estrogen कुठे synthesis होता? Ovary and the placenta. The small amount of the estrogen is also secreted by the male in their testes and the adrenal cortex. In 19th year, it was found that the ovaries control the female reproductive system. Means previously it is not much aware, but after the 19th century it will came to know that the female the ovaries plays the major role in the reproductive system, and that ovaries are acting by the hormonal mechanism. Then Allen and Dorsey in the 1923 found the alcoholic extract of the ovary, and after the studying that alcoholic extract of the ovary, they will came to know about the estrogen or the estradiol. Then there are two types of estrogen. First, it is a natural estrogen, and second, it is a synthetic estrogen. Natural estrogen म्हणजे काय तर already femaleच्या body मध्ये present असतं. Some women are facing the problem during their menstruation that needs to take the external tablet. and that external tablets are nothing but the synthetic estrogen. All of you clear? दोन टाइपचे एस्ट्रोजन असतात. फर्स्ट इट इज अ नॅचरल, सेकंड इट इज अ सिंथेटिक. नॅचरल कुठे असतं? ऑलरेडी बॉडीमध्ये प्रेझेंट असतं. जर बॉडीमध्ये प्रेझेंट नसेल, डिफिशियन्सी असेल बाय द व्हरायटी ऑफ द रिझन्स, that time it is necessary to take the external, and that external is nothing but the synthetic estrogen. What is the natural estrogen? Natural estrogen is having the 3 endogenous estrogen. म्हणजे नॅचरल इस्ट्रोजनचे पण पर 3 टाइप पडतात बॉडीमध्ये. कुठले कुठले? तर इस्ट्राडायोल, इस्ट्रोन अँड इस्टेरियोल. ओके, इस्ट्राडायोल, इस्ट्रोन अँड इस्ट्रियोल. ओके, हे 3 टाइप आहेत इस्ट्रोजनचे नॅचरल मध्ये पण. क्लिअर? मग कसं डिफरन्शिएट होतं? तर इस्ट्राडायोल इज सिंथेसाइज्ड बाय द ओव्हरी. म्हणजे ओव्हरी जे हॉर्मोन सिक्रेट करते. इन केस ऑफ नॅचरल इस्ट्रोजन इट इज अ इस्ट्राडायोल. देयर स्ट्रक्चरल डिफरन्सेस आर देयर. Then estrone is both formed by the estradiol after the oxidization in the liver. म्हणजे इस्ट्राडायोलचं पुढे जाऊन जेव्हा ऑक्सिडेशन होतं तर त्यावेळी त्याचं ब्रेकेज होऊन इस्ट्रोन आणि इस्ट्रॉल हे 2 पुढचे पार्ट तयार होतात आणि दॅट विल प्ले द डिफरंट रोल इनसाइड द बॉडी. लक्षात येते सगळ्यांच्या? सगळ्यात पहिल्यांदा इस्ट्राडायोल सिंथेसिस होतं ओव्हरीतनं. देन इट विल केम इनटू द लिव्हर विथ द ब्लड सर्क्युलेशन अँड देन इट विल गेट ऑक्सिडाइज्ड. After the oxidation, it will divided into the 2 parts, that is the estrone and the estrol. Depends upon need of the body. कुठल्या टाइपची फंक्शनची गरज आहे आपल्या बॉडीला त्यानुसार त्याचं ऑक्सिडेशन होतं and then it will be oxidized. The male secreted the small quantity 2 to 20 microgram per day. मेल मध्ये इस्ट्राडायोल हे 2 to 20 microgram per day सिक्रेट होत असतं फ्रॉम द टेस्टेस्टेरॉन. ओके, इन द फिमेल androstenedione, it will aromatize. म्हणजे त्याचं काय होतं तर aromatic ring मध्ये कन्वर्जन होतं and conversion of estrone. Further it will form the estriol. Okay, and in case of male from the testosterone पासून तयार होतं testradiol and it will be further breaked into the estriol. Clear? Then what is the synthetic estrogen? Synthetic estrogen, it is a natural estrogen is get inactivated orally. म्हणजे जर एखाद्या एनिमल मधलं इस्ट्रोजन आपण सिक्रेट सिंथेसिस केलं किंवा आयसोलेट केलं आणि आयसोलेट केलेलं इस्ट्रोजन एखाद्या ह्युमन बिंगला दिलं ओरली, देन इट विल गेट इनॅक्टिवेटेड बाय द मेकॅनिझम ऑफ द स्टमक और पीएच ऑफ द स्टमक. अँड दॅट इफ इट इज गिवन बाय द इंजेक्शन रूट, देन इट विल हॅव्हिंग अ शॉर्टर ड्युरेशन ऑफ ऍक्शन. And it will by mechanism it will get metabolized inside the liver. To overcome this side effect, the synthetic components are produced. म्हणजे इस्ट्रोजन आपल्याला ऍज सच एखाद्या ह्युमन बॉडी मधनं आयसोलेट करून दुसऱ्याला देणं पॉसिबल नाहीये. का? ओरली दिलं तर त्याचं ऍसिड मध्ये डिग्रेडेशन होत आहे. जर सपोज इंजेक्शनने दिलं किंवा अदर रूटने दिलं तर लिव्हर मध्ये जाऊन मेटाबोलाइज होतं. त्यामुळं इट इज नेसेसरी टू मेक द सिंथेटिक डेरिव्हेटिव्ह. त्यामुळे सायंटिस्टला स्टडी करून त्या इस्ट्रोजन सारखा दिसणारा टोटल सिंथेटिक डेरिव्हेटिव्ह तयार करावा लागला आणि दॅट इज नथिंग इस्ट्राडायोल. ते तयार केलेलं सिंथेटिक कंपाऊंड टोटली लॅब मध्ये ते टोटल सिंथेटिक कंपाऊंड आहे, त्याला आपण म्हणतो इस्ट्राडायोल. इट विल बी फर्दर डिवाइडेड और हॅव्हिंग अ स्ट्रक्चरल डिफरन्सिएशन, दॅट इज अ इथिनिस्टेराड्रॉयल, मेन्स्ट्रेनॉल अँड द टिबेलोन. Okay, and non-steroidal derivative which is showing a similar action as that of estrogen, that is a diethylstilbestrol, hexastrol and the dinesterol. हे वेगळे वेगळे डेरिव्हेटिव्ह आहे. If some women are suffering from the menstrual problem and if they taken the medicines, that time that medicine is one amongst this. ह्यापैकी 100% एक ड्रग असतं. क्लिअर? Why? It is a synthetic derivative. Clear everyone? Then regulation of the secretion depend upon the phase of the menstrual cycle. The estrogen is vary in the concentration of the 10 to 100 microgram. म्हणजे जसं पहिल्यांदा बघितलं आपण तसं कुठल्या दिवशी आपण टेस्ट करतोय ह्याच्यावर ठरतं की बॉडीत किती इस्ट्रोजन प्रेझेंट आहे. Why? Because the women are continuously suffering from the menstrual changes. During the pregnancy, the placenta will secrete the large quantity of the estrogen, that is a 30 mg per day, and that level is get decreased after the delivery. because during the delivery, to maintain the pregnancy situation, the estrogen is plays the major role. Okay, what is the action? मग इस्ट्रोजनची काय ऍक्शन आहे आपल्या बॉडीमध्ये? तर we will study the effect of the estrogen on the sex hormone, on the secondary sex characteristic and the metabolotopic organelles processes. Means estrogen is having the variety of the role, पण त्यातल्या त्यात आपल्याला मेजर रोल कुठले इंटरेस्टेड आहेत? फर्स्ट इन द सेक्स ऑर्गन, सेकंड इट इज सेकंडरी सेक्स कॅरेक्टरिस्टिक्स अँड द मेटाबॉलिक ऑर्गन्स. ओके, देन व्हॉट इज द मेकॅनिझम ऑफ ऍक्शन? मग कसं ऍक्शन दाखवतं इस्ट्रोजन? सिमिलर लाईक अ अदर स्टिरॉइड इस्ट्रोजन बाइंड विथ द 4 न्यूक्लियर रिसेप्टर्स इन द टार्गेट सेल. म्हणजे आपल्या ज्या ऍक्शन पाहिजे, म्हणजे जे पहिल्यांदा 3 बघितले आपण, first is a sex organ, then the second is sex characteristics, and the next third it is a metabolotropic organs. तर त्या तिन्हीतल्या ज्या टार्गेट सेलवर आपल्याला ऍक्शन दाखवली आहे तिथं 4 न्यूक्लियर रिसेप्टरला जाऊन ते बाइंड होतं. आफ्टर द बाइंडिंग टू दॅट न्यूक्लियर रिसेप्टर इट विल प्रोड्यूस द इफेक्ट बाय द रेग्युलेटिंग प्रोटीन सिंथेसिस. म्हणजे इस्ट्रोजन आपल्या बॉडीतलं जातं, न्यूक्लियर रिसेप्टरला बाइंड होतं, अँड देन इट विल कॉजेस द न्यूक्लियर चेंजेस, and that nuclear changes are responsible for the regulating proteins. मग आपल्या बॉडीच्या डेव्हलपमेंट साठी जे प्रोटीन्सची गरज आहे ते प्रोटीन सिंथेसिस करतं इस्ट्रोजन. क्लिअर? दॅट इस्ट्रोजन रिसेप्टर प्रेझेंट इन द फिमेल सेक्स ऑर्गन like a breast, pituitary, liver, bone and the blood vessels, heart and the CNS. That variety of the areas are contain the estrogen receptor. And त्या एरियामध्ये जाऊन estrogen is showing it's a different action. Means when estrogen is bind with the receptor on the pituitary gland, their action is different. When estrogen is bind to the receptor present on the liver, that action is different. Clear everyone? Then estrogen receptor is having the 2 types. There is the estrogen alpha receptor, estrogen beta receptor. Alpha receptor is specifically present on the uterus, vagina, breast, bone and the hypothalamus, while estrogen beta receptor are present on the prostate gland of the male and the ovaries of the female. All of you got कुठं रिसेप्टर असतात, किती टाइपचे रिसेप्टर असतात? एव्हरीवन गॉट? Specifically the estrogen is showing its action after the binding to its estrogen receptor. That much clear? After the binding, where that estrogen receptors are present, the estrogen receptor is widely spread over the body. Where it will be present on the sex organ, it will be present on the breast, it will be present on the pituitary gland, it will be present on the vessels, heart and the CNS. That much clear? Again, estrogen receptor is having the 2 types. First, estrogen alpha receptor and estrogen alpha beta receptor. Sorry, estrogen beta receptor, alpha and beta. Then where the alpha is present? The alpha is present on the uterus, vagina, breast, bone and the hypothalamus. While the beta receptor is only and only present on the prostate gland of the male and the ovaries of the female. Clear? What is the action? Step by step. What is the mechanism of action? First, agonist means estrogen will bind with the estrogen receptor. सगळ्यात पहिल्यांदा जर एखाद्या बॉडीमध्ये इस्ट्रोजन सिक्रेट झालं, काय होतं? ते इस्ट्रोजन विल बाइंड विथ द इस्ट्रोजन रिसेप्टर. आफ्टर दॅट इट विल बी कॉजेस द डायमरायझेशन ऑफ रिसेप्टर. जर तुम्हाला न्यूक्लियर रिसेप्टरचं मेकॅनिझम आठवत असेल, न्यूक्लियर रिसेप्टर जेव्हा स्वतःची ऍक्शन दाखवतं त्यावेळी ते काय करतं? इट विल बी कॉजेस द डायमरायझेशन प्रोसेस. So that when the estrogen will bind with its receptor, it will causes the dimerization. After the dimerization of the receptor, it will causes the interaction of the estrogen responsible element of the target genes. Means indirectly it will activate the target genes. That target genes is act as a co-activator of the protein and it will be responsible for the gene transcription. And that genes are causes the various pharmacological action. मग या फार्माकोलॉजिकल ऍक्शन कुठल्या असणार आहे? तर डिपेंड्स अपॉन विच एरिया, विच लोकेशन द इस्ट्रोजन रिसेप्टर गेट ऍक्टिव्हेटेड. इफ that estrogen receptor is present on the sex organ, then we produces the puberty changes in the female. Means like growth of the uterus, growth of the fallopian tubes and growth of the or development of the vagina. Then vaginal epithelium become a thick, it is a stratified and the concerning. Then estrogen is responsible for the proliferation, while The progesterone is responsible for the secretory changes. म्हणजे बॉडीमध्ये जे secretory changes होत असतात, various secretions are there, menstrual secretion is there, that is responsible by the progesterone. And the development changes are there, means development of the uterus, development of the fallopian tube, development of the endometrium. In that the estrogen is playing the role. लक्षात येत आहे, सिंपल लॉजिक आहे. डेव्हलपमेंट जिथं असते तिथं इस्ट्रोजन असतं, and जिथं सिक्रिशन्स असतं that time the progesterone is playing the role. Clear? If the estrogen is given to the individual without progesterone, नॉर्मल बॉडीमध्ये इस्ट्रोजन आणि प्रोजेस्ट्रॉन दोन्ही रोल करत असतात, पण अशा एखाद्या पर्सनला इस्ट्रोजन दिलं विदाउट प्रोजेस्ट्रॉन, इट विल बी कॉजेस द डिलेड but gap by gap bleeding or irregularities inside the bleeding. Clear? Then simply the estrogen is playing the rhythmic contraction of the fallopian tubes. म्हणजे fallopian tubes जर contraction करायचं असेल तर estrogen is playing the role. The estrogen sensitizes the uterus to the oxytocin. म्हणजे त्यानंतर जे बॉडीमध्ये ऑक्सिटोसिन हॉर्मोन सिंथेसिस होतं, तर त्या ऑक्सिटोसिन हॉर्मोनला ऍक्टिव्हेट करण्याचं काम कोण करतं, तर इस्ट्रोजन करतं. देन व्हॉट आर द सेकंडरी सेक्स कॅरेक्टरिस्टिक्स? इस्ट्रोजन produces during the puberty, causes the growth of the breast, also growth of the fallopian tube ducts and the stroma, which further responsible for the accumulation of the fat, so that at the age of the age of the puberty, the females are looking somewhat fatty. Because the accumulation of the fat is get responsible by the estrogen. The puberty and the axillary hairs is occurs and the feminine or body shape is get developed due to the uterus. Estrogen. Okay. The acne, it is a common problem associated with the puberty and in the some girls as well as in the some boys. Why? Because due to the small androgen produces the continuous release of the estrogen. Means at the age of the puberty we face the problem of the acne, means pimples, and that is also due to the release of the estrogen inside the body. Clear? Then what are the metabolic effect? What are the various metabolic effect inside the body? The estrogen, it is an anabolic. Anabolic means the small building block, the small molecule to the large. म्हणजे estrogen indirectly काय करताय, डेव्हलपमेंट करताय. ओके, म्हणजे मेटाबॉलिक ऍक्शन पण काय असणार आहे, डेव्हलपमेंटचे असणार आहे. मीन्स वी आर बिकम अ बिगर. ओके, म्हणजे लहानपणी आपण कसं असतो, लहान असतो, मोठं होत जाईल जाईल कसं होतं, आपण डेव्हलप होत जातो स्वतः. व त्या डेव्हलपमेंटचा रोल कोण प्ले करतं, इस्ट्रोजन प्ले करतं. क्लिअर? इस्ट्रोजन इट इज अ अनाबोलिक अँड बट लेस अनाबोलिक दॅन द टेस्टेस्टोरॉन. मेल मध्ये कसं असतं, टेस्टेस्टोरॉन अनाबोलिक आहे. क्लिअर? मेल मध्ये. आणि फिमेल मध्ये इस्ट्रोजन अनाबोलिक आहे. पण testosterone is a more anabolic, so that we found that the woman is developing its body within the age of the puberty, but the boys will develop their body after the age of puberty as well. Clear? Why? Because the testosterone is more anabolic as compared to estrogen. The small amount of the androgen is required for the pubertal growth inside the girls as well as boys. The continuous action of the estrogen will increase the fusion of epiphyses. Okay, epiphyses. What is the epiphyses? You may search on the internet. Okay. Then the estrogen is also important for maintaining the bone mass. Therefore, the estrogen will inhibit the osteoclast. Okay, formation. It will increase the expression of the bone matrix proteins like a osteonectin and the collagen. लाइक अल्कलाइन फॉस्फेटेज. म्हणजे इस्ट्रोजन इनडायरेक्टली काय करतंय, तर बोन ग्रोथ करतं, बोन डेव्हलपमेंट करतं, कोलॅजिन रिलीज करतं. ऑल्सो इट विल प्रोड्युसेस द पॉझिटिव्ह कॅल्शियम बॅलन्स. म्हणजे यंग एज मध्ये ज्या गोष्टी घडतात चांगल्या, दॅट विल बी रिस्पॉन्सिबल बाय द इस्ट्रोजन. क्लिअर? मग जसं जसं एज वाढत जातं, एक फेज मध्ये आलं की काय होतं, बोन डेन्सिटी डिक्रीज व्हायला लागते. वाय? दॅट टाइम द इस्ट्रोजन लेवल गेट डिक्रीज इनसाइड द बॉडी. All of you clear? Then at the normal dose of the estrogen, it will causes the retention of the salt and the water, which will be produces the edema like situation. Also it will increases the blood pressure after the prolonged use. Okay, my estrogen use कधी होणार आहे? Specifically the estrogen is taken for the contraceptive purpose only. The estrogen will decreases the plasma low density lipid as well as cholesterol. It will increases the high density lipids and the triglycerides. Okay. It will increases the synthesis of clotting factor so that the blood coagulability is get increased. It also decreases the plasminogen activator factor and it will be produces the fibrinolytic activity. म्हणजे indirectly हे काय करताय blood ला viscous करताय. Indirect action. Okay. Then the plasma level, increase the plasma level of the sex hormone, increases the binding globulin, also increases the thyroid binding globulin and it will be increases the cortisol bonding globulin. म्हणजे ज्या गोष्टी आपल्याला डेव्हलप करतात त्या गोष्टी इन्क्रीज करण्याचं काम कोण करतं? इस्ट्रोजन करतं. Clear? Then what is the pharmacokinetic of the estrogen? It will absorb orally, transdermally. Okay, but synthetic derivative. ओके, सिंथेटिक डेरिव्हेटिव्ह जो आहे तोच आपला ओरली आणि ट्रान्सडर्मली ऍक्टिव्हेट होतो. नॅचरल इस्ट्रोजन इज गेट डीऍक्टिव्हेटेड बाय द ओरल रूट. देन द मेटाबॉलिझम, इट विल गेट मेटाबोलाइज्ड इनसाइड द लिव्हर अँड by the glucuronic conjugation and it will be excreted in the bile itself. Then what are the various preparations? The all estrogen preparations is having the similar action and most of the time they are given by the oral route or the transdermal route. मग कुठले कुठले डेरिव्हेटिव्ह देतो आपण? तर वी आर गिवन द एस्ट्राडोल like a salt of the benzoate, then the kryptonate. It is given the derivative specifically by the intramuscular injection. Means most of the girls are suffering from that problem. It means if they are having the some of the bleeding disorders, that time they needs to take one of the injections. They will count their own time and they will went toward the doctor and they are taken the injection. That time only they will get the periods. Okay, why it is so? Doctor is prescribing the estrogen derivative. Then what are the adverse effects? Most of the adverse effects are seen with the hormonal replacement therapy and the oral contraceptive therapy. म्हणजे जर one woman are suffering taken the oral contraceptive, that time the various adverse effects are seen and that adverse effect is nothing but that due to the overdose of the estrogen. What are that? It is a suppression of the libido, means the sex desire. Also there is a gynecomastia, feminization is there, means more features, body features is get developed inside the woman when the estrogen is administered by the male. म्हणजे चुकून or a variety of the reason the male is taken the estrogen, that time that male is starting to develop the feminine characteristics. Okay, then when the given to the children, जर लहान मुलांमध्ये दिलं estrogen, what is happening? It will causes the fusion of the epicepts and the reduction of the adult structure. म्हणजे त्या केस मध्ये काय होतं, त्या छोटं बेबी जे असेल किंवा जे कुठले चिल्ड्रन असेल ज्याला आपण इस्ट्रोजन दिले, दॅट विल स्टार्ट टू डेव्हलप द अडल्ट कॅरेक्टरिस्टिक्स. क्लिअर? देन if the breast cancer is there, the estrogen is given. Okay, definitely in treatment of breast cancer the estrogen is given. That time it increases the risk to the development of the new cancer. So wait for one Okay, sorry for your interruption, but one of the feedback call is there from for your colleague, senior colleague from the company. So I need to pick up that call. Thank you. Then where we are? We given the estrogen in case of breast cancer, it will increases the development chance to develop the new cancer, but it needs to give because as such it is a hormone. म्हणजे कंडिशन अशी असते की ती कंडिशन ट्रीट करण्यासाठी आपल्याला इस्ट्रोजन द्यावंच लागतं, पण इस्ट्रोजन दिल्यामुळं त्या कंडिशनची सिव्हिअरिटी स्लाइटली इन्क्रीज होते. देयर इज अ चान्स टू डेव्हलपमेंट ऑफ द न्यू कॅन्सर. The long-term treatment of the therapy of the estrogen develop the gallstones and benign hepatoma. Common side effect like a migraine, epilepsy, and endometriosis. If the stilbestrol given to the pregnant woman, there is a increase the incidence of the vaginal and the cervical carcinoma. Then what are the uses? मग काय यूज आहेत एवढ्या इस्ट्रोजनचे? The estrogen is specifically given in a treatment of the hormonal replacement therapy. Also in the senile vaginitis is given in the delayed puberty in the girl, in the dysmenorrhea situation, acne problems. It will given in the dysfunctional uterine bleeding, and also it is given in the prostate carcinoma. Clear? These are the all related with the sexual disorders, sexual reproductive system disorders. What is it? You may read later. Okay, I will not explain you what is mean by menstrual dysfunctioning, prostate carcinoma. I will all explain here. If you read that time you came to understood that. Okay, what is meant by dysmenorrhea, what is meant by acne, or what is the all things. Clear? Then next part, that is the anti-estrogen. Means in some cases we need to give the anti-estrogen therapy. म्हणजे कधी कधी काय होतं बॉडीमध्ये ऑटोमॅटिकली इस्ट्रोजन लेवल गेट इन्क्रीज, or sometimes if we are given externally estrogen, like a majority of the time menstruation problem, that time we need to give the anti-estrogen. Or sometimes as such in our body estrogen level get increased, that time we observe the various problems inside the body, and that time we need to give the anti-estrogens. Okay, then what is the anti-estrogens? The estrogen antagonist, म्हणजे इस्ट्रोजनची ऍक्शन बॉडी मध्ये होऊ देत नाही. ते estrogen antagonist was found in a 1970, which is depends upon the hormonal background of the previously used antagonists are clomiphene citrate and the tamoxifen citrate. म्हणजे दोन डेरिव्हेटिव्ह आहेत जे इस्ट्रोजनच्या अगेन्स्ट ऍक्शन दाखवतात. कुठले कुठले? तर क्लोमिफेर सिट्रेट अँड द टॅमॉक्झिफेन सिट्रेट. म्हणजे दोन टाइपचे इस्ट्रोजनचे रिसेप्टर आहेत, ER अल्फा अँड ER बीटा रिसेप्टर्स. त्या रिसेप्टर वरती इस्ट्रोजन इज शोइंग इट्स ऍक्शन. क्लियर? देन which are they? That is the naloxone and the tormifene. Okay, then aromatase inhibitor, म्हणजे जे काही इस्ट्रोजनचं अरोमॅटिक स्ट्रक्चर आहे त्या स्ट्रक्चरचं ए रिंग जे आहे ती अरोमॅटायझेशन प्रिव्हेंट करतं. Which are that drug? That is a letrozole and the extremestrone. Okay, these are the derivative which will be used to break the structural derivative, structure of the estrogen derivative. Clear? Then we will see one by one drug, like the clomiphene. The clomiphene citrate, how it will be showing its action? The clomiphene citrate will bind to the alpha as well as beta receptor of the estrogen, and it will block the action of the estrogen to that receptor. Then it will decrease the estrogen synthesis and we get the anti-estrogenic action. म्हणजे सिम्पली हे डेरिव्हेटिव्ह काय करतात, जातात रिसेप्टरला जाऊन बाइंड होतात, त्यामुळे तिथं इस्ट्रोजन येऊन बाइंड होऊ शकत नाही आणि वी गॉट द अँटी इस्ट्रोजेनिक ऍक्शन. क्लियर? अँटी इस्ट्रोजन डेरिव्हेटिव्ह. देन व्हॉट आर द ऍडव्हर्स इफेक्ट? मग दिल्यानंतर अँटी इस्ट्रोजन डेरिव्हेटिव्ह जर दिले काय होतं पर्सन मध्ये, तर इट विल बी कॉजेस द पॉलिसिस्टिक ओव्हरीज, मल्टिपल प्रेग्नन्सीज इज ऑल्सो देअर, sometimes the gastric upset is there, vertigo is there, allergic dermatitis is there, and sometimes there is a risk of the ovarian tumor is also there. And what is the uses? It is used for the treatment of anti-fertility. Okay, to bring the fertility because the fertilization was occurred at the 50 mg for 5 days. म्हणजे मोस्ट ऑफ द टाइम अँटी इस्ट्रोजन डेरिव्हेटिव्ह कधी देतो आपण, तर इनफर्टिलिटी असेल एखाद्या पर्सन वुमनला, तर त्या वुमनला फर्टिलिटी बेअर करायची असेल तर त्या केसमध्ये आपण अँटी इस्ट्रोजन डेरिव्हेटिव्ह देतो. क्लिअर? ऑल्सो इट इज युज्ड फॉर द इन व्हिट्रो फर्टिलायझेशन, म्हणजे जे आपण बघतो की टेस्ट ट्यूब बेबीज वगैरे, तर त्या केसमध्ये इन व्हिट्रो फर्टिलायझेशन जर व्हायचं असेल तर त्या केसमध्ये आपण इस्ट्रोजन यूज करतो टू डेव्हलप द फर्टिलायझेशन इन व्हिट्रो. ओके, पीसीटी वगैरे आजकाल बघितले असेल टेक्निक, तुम्ही वाचले असतील, तर त्या केसमध्ये इस्ट्रोजन वी आर युजिंग. देन ऑल्सो वी आर युजिंग इन द ऑलिगोझोस्पर्मिया, मीन्स द इन मेन there is a increase the spermatogenesis process and testosterone secretion. So the anti-estrogen derivative is used for the male infertility condition due to the faulty sperm secretion cases. Okay, then some of the selective estrogen receptor modulators are there. Example, it is a tamoxifen and the lanoxafen. It is also used as a estrogen antagonist. म्हणजे हे जे डेरिव्हेटिव्ह आहे टॅमॉक्झिफेन वगैरे, तर हे डेरिव्हेटिव्ह पण इस्ट्रोजनच्या अगेन्स्ट यूज करतात. मीन्स दॅट डेरिव्हेटिव्ह विल बाइंड सिलेक्टिव्हली बाइंड विथ द इस्ट्रोजन रिसेप्टर and they will block the action of estrogen on the body. Clear? Then it is a major important part, that is a hormonal contraceptive. तुमच्या सिलेबस मधला 100% दरवेळेस 10 मार्क्स क्वेश्चन मध्ये येणारा क्वेश्चन आहे hormonal contraceptive. What is the hormonal contraceptive? It is also called as a anti-fertility agent. Hormonal contraceptive चं दुसरं नाव काय? Anti-fertility agents. These are the hormonal preparation. काय आहेत hormonal contraceptives? तर these are the hormonal preparation used for reversible suppression of fertility. म्हणजे fertility होऊ देत नाहीत. These are nothing but the anti-fertility agents. And if they are taken the oral route, आणि जर त्या टॅबलेट त्या कॅप्सूल जर ओरल रूट ने घेतला तर त्याला आपण म्हणतो ओरल कॉन्ट्रासेप्टिव्ह. क्लिअर? प्रिव्हियसली the various methods are used for the prevention of the pregnancy, but nowadays there are various failure rates are observed, so that in the 1955 the successful use of the oral progesterone is for the contraception purpose is used. There are various routes of the administration of the progesterone, that is a contraceptive purpose, like oral injection and the implants to reduce the infertility. The oral contraceptives are the example of the combined pills, phase regimen, mini pills and the postcoital emergency contraceptives. Okay, वेगळ्या वेगळ्या टाइप्स असतात त्याच्यामध्ये. फर्स्ट इट इज अ कंबाइंड, सेकंड इज अ फेज रेजिमेन and third it is a mini pills. What is the combined? It is a combination of the estrogen and progesterone and it is a firstly introduced in the market. म्हणजे सगळ्यात पहिल्यांदा वर्ल्ड मध्ये मार्केटमध्ये contraceptive pill म्हणून combination आलं, that is estrogen and progesterone. Why? Because that time there is not much awareness is there. The second generation derivative, it contain the amount of the estrogen and progesterone is get decreased, but their effectiveness is remain as it is. म्हणजे estrogen ची क्वांटिटी तेवढीच ठेवली पण प्रोजेस्टेरॉन ची क्वांटिटी कमी केली, पण एक लक्षात आलं की त्याचा इफेक्ट तेवढाच राहिला. While in the third generation derivative, newer derivative, the progesterone is replaced with the estrogen, desogestrel. Okay, deestrogen derivative जो आहे तर त्याला रिप्लेस करून कोणाला वापरलं तर प्रोजेस्टिनला. क्लिअर? आणि हे आता थर्ड जनरेशन पिल्स आहे. The third generation pills is acting the synergistic action to inhibit the ovulation and having the less androgenic activity and the less lipoprotein metabolism. म्हणजे त्यातल्या त्यात चांगलं म्हणणार नाही मी त्याला, बट त्यातल्या त्यात चांगलं पहिल्या दोन कंडिशन पेक्षा थर्ड जनरेशन इट इज अ इफेक्टिव्ह डेरिव्हेटिव्ह. देन what is the phase regimen? The phase regimen is advised to reduce the total steroidal dose without affecting efficiency. These are the biphasic and the triphasic. इस्ट्रोजन डोस इज केप्ट कॉन्स्टंट. म्हणजे ह्याच्यामध्ये काय केलंय तर फेज रेजिमेन केलंय. इफ यू सॉ द ओरल कॉन्ट्रासेप्टिव्ह स्ट्रीप दॅट टाइम यू गॉट द एरोज. म्हणजे जर तुम्ही ओरल कॉन्ट्रासेप्टिव्हची स्ट्रिप्स बघितली तर त्यात टाइम तुम्हाला काय लक्षात येईल तर एरो असतात त्याच्या पुढे. ओके, सो व्हॉट दे आर सजेस्टिंग, यू हॅव टू टेक द डोस फर्स्ट टू द 30. ओके, त्याला एरो केलेले असतात ते मार्केटमध्ये प्रिपरेशननी. तर त्यात त्यांनी काय सांगतायत तर फर्स्ट डे पासून लास्ट पर्यंत तुम्ही ते घेऊ शकता. सो आय एम ऑलवेज ऍडवाइजिंग टू द गर्ल्स, फिमेल कॅन्डिडेट और बॉयज ऑल्सो, इफ दे आर मीन्स they also have to suggest their family members, female family members, that don't take the menstrual pause tablets within a one duration only. Means if we went toward the medical shop and if we take the 2 tablets, 4 tablets, 6 tablets, that time they are cutting the strips and they are given any random section of that tablets. They are not aware that much, or as such it is not done by the pharmacist, but it is happening. So which section they cutted, that part we will get. Okay, understood? So many complaints are there regarding some women are suffering from the severe side effect. Some women are suffering that they are taken the tablet but still menstruation is there. Why it is so? Because we are taken from the any section, we are not taken the strip. Okay, and that strip is having the variation in their dosage. All of you understood? And that is a in the here the estrogen dose is kept constant, but in the first phase the progesterone is low and that increases up to the third phase. म्हणजे जे दिवस दिले त्याच्यावरती तर त्या डेज मध्ये प्रोजेस्ट्रिनची लेवल वाढवली जाते. इस्ट्रोजन इज रिमेन अ कॉन्स्टंट फॉर द होल पिरियड. क्लियर? द फेजिक पिल्स आर ऍडवाइज्ड फॉर द वुमन अबाउट द 35 एज. स्पेसिफिकली 35 एजच्या वरती ज्या वुमन्स आहेत तर त्यांना फेजिक पिल्स ऍडवाइज केल्या जातात. व्हॉट इज द मिनी पिल्स? द मिनी पिल्स आर कंटेन द ओनली प्रोजेस्टिन. फक्त प्रोजेस्टिन डेरिव्हेटिव्ह असतो मिनी पिल्स मध्ये. इस्ट्रोजन इज इलिमिनेटेड टू ओव्हरकम द साइड इफेक्ट्स अँड इट विल बी प्रोड्युसेस द गॅप और इट विल बी प्रोड्युसेस. फक्त प्रोजेस्टिन बॉडीमध्ये गेल्यामुळे इम्बॅलन्स होतो हार्मोन्सचा and that will be problematic for the bearing the pregnancy. Okay, clear? Then the postcoital emergency contraceptive, currently the 3 market regimens are available, that is the levonorgestrel and the levonorgestrel and the mephisterol. Means that various brands are available in the market for these tablets. That tablets are contain the most of the time lenosterol with the ethylene derivative. As such, that is the overall brand name is there. If it is taken within a once it is taken between the 72 hours, it will be protect from the bearing the pregnancy. Clear? The repeat dose after the 12 hour is method is called as a UPS method, and these type of contraceptives are more popular, but these are having the 100% reporting cancer. Okay, once if you taken the emergency contraceptive, there is a chance, it is not a chance, there is a 100% guarantee to development of the cancer. So don't use the emergency contraceptive. It will be used only when there is an unprotected or the accidental exposure cases. Okay, so don't use that. It is having the mechanism that it will be inhibit the gonadotropin release from the pituitary, and that time there is a no secretion of the FSH and the LSH inside the body. The uterine and the tubular contraction prevent the fertilization, and for the mini pill and the postcoital pills, the postcoital pills force out the implanted blastol, which is a prevent fertilization. Means after the taken the emergency contraceptive, there is a definite chances to get menstruated because it will force the uterus, and once we are means making the imbalance, by mean we are preventing the imbalance, there is a chances to development of the cancer inside the uterus. म्हणजे 100% ब्रेस्ट कॅन्सर किंवा युटेराइन कॅन्सर रिपोर्टेड आहे इफ द वुमन्स आर टेकन द इमर्जन्सी कॉन्ट्रासेप्टिव्स. ओके, then what are the practical consideration? The discontinuation of the oral contraceptive treatment, return the fertilization after the 1 to 2 months. म्हणजे if anyone wish to bear a pregnancy, that time we need to stop the fertilization contraceptive therapy before the 1 to 2 months. Okay, and after the 2 to 3 cycle repetition of the menstruation, that time it is necessary to take the chance. Okay, then the dose required for the contraception is for the normal healthy woman 30 microgram, and obese woman it needs to take the 50 microgram, and having the woman 40 years above or cardiovascular disease, it needs to take the 20 microgram. Clear? Then what are the adverse effects? The long-term use of the contraceptives may develop the variety of the serious adverse effect, like some of the non-serious side effect, like appetites or various, means if we categorize the side effect, म्हणजे जर आपण घडणाऱ्या साइड इफेक्टला कॅटेगराइज करायचं ठरवलं तर आपण 3 टाइप मध्ये कॅटेगराइज करतो. फर्स्ट, इट इज अ नॉन सिरियस साइड इफेक्ट. सेकंड, इट इज अ सम साइड इफेक्ट्स विच विल अपियर लॅटर, म्हणजे आता 10 वर्ष जर ओरल कॉन्ट्रासेप्टिव्ह घेतली तर काही इफेक्ट दिसत नाही, पण 10 वर्षांच्या नंतर लॉंग टर्म यूज नंतर आपल्याला काही साइड इफेक्ट दिसतात आणि काही सिरियस साइड इफेक्ट असतात. फर्स्ट, द नॉन सिरियस साइड इफेक्ट लाईक नॉशिया, वॉमिटिंग, सिकनेस, कंटाळा आल्यासारखं होतं. समटाइम्स द ब्रेस्ट डिस्कम्फर्ट इज ऑल्सो देअर. Sometimes the breakthrough bleeding is also there, means menstruation cycle is not within a duration. It is a common side effect. Then what is a side effect which will be appears later, म्हणजे कुठल्याही टाइपची जर कॉन्ट्रासेप्टिव्ह घेतली तर लॉंग टर्म ड्युरेशन मध्ये काय परिणाम होतो आफ्टर द फ्यू इयर्स लॅटर? Weight gain is there, acne is there, increased body hairs is also there due to the androgenic activity. Sometimes there is a pruritus, ovulation, means the ovulation is after the 6 months of the delivery. There is abortion, threatening abortion is there. Sometimes there is a mood swing is also there. All of you mute yourself. Bhavna, mute yourself everyone. Then what is the serious side effect? The serious side effect is a thrombosis, pulmonary embolism is also observed. Then hypertension is also chances. Also there is a estrogen is precipitate the thromboembolism. Blood clotting factor is increased. Platelet aggregation is also observed, so that we will observe the increase the blood pressure of that woman. Also there is a increasing the chances of high density lipid and low density lipid ratio. There is a genital carcinoma, like a chances to increase the vaginal and cervical as well as breast cancer. Being hepatomas, means high dose of the steroid or high dose of the estrogen, it chances to develop the hepatomas, means failure of the hepatitis, that is the liver, and the gallstone is also developed. Then what is the contraindication? Means the oral contraceptive is not given to already cardiac woman, cardiac disorder suffering woman, hypertension woman, liver women which are suffering from the liver disorder. Some women are already developed the malignancy condition, obese disorder, uterine lymphopathy. Then there is an age above the 35 years and the gall disorder. These women are not advisable to take the oral contraceptive. Then what are the interaction? The derivative which will be induces the enzymes or hormones like phenytoin, phenobarbiturate, rifampicin. That derivative are not taken along with the oral contraceptive. Some agents like a tetracycline and ampicillin which suppresses the intestinal microbial flora, so that along with that derivative the oral contraceptives are not taken. Then what are the other uses? The other uses of the oral contraceptive, like lowering the risk of the developing endometrial and the ovarian carcinoma. As such, it is a hormone. The woman which is having the deficiency of that hormone, that time we are needs to give the external hormone, like a condition ovarian carcinoma, means already ज्यांची ओव्हरी काढून टाकली आहे तर त्या वुमन मध्ये डिफिशियन्सी होणार आहे हॉर्मोनची, तर त्या केस मध्ये एक्सटर्नली ओरल कॉन्ट्रासेप्टिव्ह दिल्या जातात. इट इज improve the condition of endometriosis and the pelvic inflammatory diseases. It is also used in a by cystic breast condition. That case also we are given the external estrogen derivative. All of you clear the estrogen derivative? Anyone have any doubt? Anyone have any doubt? Then I will give you the androgens derivative notes to you. Okay, it is a similar like a female characteristic, female reproductive system. It is similar with the male reproductive system. All of you read. If you have any doubt, you may ask. Okay, I will not taught this chapter in the class, means from last few years. You may read. It is a similar as that of a female characteristics. You read, it is same like a estrogen androgen derivative. If you have any doubt, you may ask to me. Clear? It is having the same effect, same mechanism of action. Somewhat similar side effects are there. Okay. Anyone have any doubt in this section? All of you read. If you have any doubt, you may ask to me. Okay. Here we completed this section. In the next lecture, we will start. Okay, we will start the. Wait, I will share. Okay, means we completed these two sections, that is the androgen and the anabolic steroid and the estrogen and the oral contraceptive. हे दोन sections आपले झाले. If I get the notes from the Kale sir, then we will start the drug acting on the uterus. Okay, हा section आपण complete करूया, drug acting on the uterus. Okay, then we will start the bioassay. So within 2 lectures, we will complete this unit number 5. All of you have any doubt? Anyone have any doubt? Tomorrow we will start with the bioassay, or we will start with the drug acting on the uterus. It is a simple bits. Majority of the bit is the estrogen, progesterone, and the oral contraceptive. In the your exam, definitely there is a question on the write a note on oral contraceptive. Okay. Anyone have any doubt? You may ask me. I will take the presentation. So we will complete this unit number 5. In your exam, the unit number 3 and 5 is there. Okay. Wait, I will take the attendance. I will share the notes on the Google Classroom. All of you refer. Roll number 3, 4, 6, 7, 8. Roll number 13. '18, 19, 20. '26, 27, 29, 30. 31, 36 to 43. '36, 37, 38, 39, 40, 41, 42, 43. 46, 47, 48. 52. 55, 57. 60, 66, 69, 70, 'Okay, thank you. Tomorrow I will also share the link and timing to which we will start our session. Okay, thank you.